Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Untreated ADHD in adults, attention deficit hyperactivity disorder, ADHD, is commonly assumed to be a childhood disorder. However, in 2/3 of cases, it continues into adulthood. The global prevalence of ADHD in adults is 3.1% higher than anxiety disorders like posttraumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. /r/n/r/n When ADHD goes untreated in adults, it can lead to functional impairments, particularly in relationships and in the workplace. Untreated ADHD may significantly affect a person's quality of life. /r/n/r/n This article explains the signs of ADHD in adults, the risks of untreated ADHD, and treatment options. /r/n/r/n Illustration by Laura Porter for Verywell Health. /r/n/r/n ADHD is known as a neurodevelopmental disorder because its onset takes place during the prenatal developmental period. During the early stages of brain development, the central nervous system and neurological pathways in the brain are formed. Issues with neurodevelopment can create a deficit, deficiency, or delay in development and behavior. /r/n/r/n In the case of ADHD, different parts of the brain are affected, including the front of the brain, or prefrontal cortex. This is the area of the brain that handles executive function, a set of mental skills that include /r/n/r/n All of these are impacted by ADHD. /r/n/r/n Adults with ADHD may exhibit inattention, lack of attention, hyperactivity, being overly active, and impulsivity, being easily swayed by and acting on urges. /r/n/r/n This video has been medically reviewed by Huma Sheikh MD. /r/n/r/NAD can be present from childhood but sometimes not recognized and diagnosed until adulthood. Often, an ADHD diagnosis in an adult is discovered when their child is diagnosed with ADHD. Parents with ADHD are often overwhelmed by parenting demands and may struggle to keep up with their children's needs. Where they may have been able to manage ADHD before becoming a parent, parenting presents new and different challenges that are difficult to navigate with untreated ADHD. /r/n/r/n Although ADHD is more common in men, the symptoms and risks manifest a little differently in men than in women. Historically, women have been underdiagnosed. They're more likely to present inattentive symptoms such as distraction and forgetfulness. These are more difficult to notice than hyperactivity and impulsivity that show up more commonly in men. /r/n/r/n Additionally, women are more likely to be treated for co-occurring conditions like depression and eating disorders, which can further delay an ADHD diagnosis. /r/n/r/n Common symptoms in men include /r/n/r/n in women. /r/n/r/n Untreated ADHD is connected to impairments in key areas of living, such as at work and school, in relationships, and in overall quality of life. /r/n/r/n In general, ADHD is not known to worsen with age. However, with treatment, medications specific to ADHD, and psychotherapy, ADHD may actually improve with age. /r/n/r/n ADHD does not typically develop into other mental illnesses. However, many people with ADHD have coexisting conditions. Other conditions that frequently co-occur with ADHD include anxiety, depression, and mood disorders. /r/n/r/n Adults with ADHD frequently experience negative attitudes because of the challenges in functioning caused by the disorder. Studies suggest that ADHD in adulthood is connected to overall lower self-esteem, but this can be improved with treatment. /r/n/r/n About 50% of adults with ADHD also suffer from an anxiety disorder. Medications and psychotherapy for ADHD and anxiety can improve both issues. /r/n/r/n Multiple studies indicate adults with ADHD have elevated levels of emotional dysregulation, poor ability to manage emotions. Self-regulation of emotions, frustration, impatience, and anger are difficult to manage with untreated ADHD. Emotional reactivity negatively impacts relationships. Treating ADHD with medication and therapy to gain communication and relationship skills can help. /r/n/r/n Adults with ADHD struggle with a variety of challenges in the workplace, including poor communication skills, distractibility, procrastination, and managing challenging projects. Psychotherapy can be helpful in gaining skills to manage ADHD in the work environment. It's also important to find a career path that plays to the strengths of ADHD, such as those in fast-paced environments. /r/n/r/n Multiple studies indicate that people with ADHD are 3 times more likely to be nicotine dependent. Those with ADHD were 50% more likely to develop a drug or alcohol use disorder than those without ADHD. Research shows that treatment with ADHD medications reduces substance misuse. /r/n/r/n Several studies indicate adults with ADHD have a small increase in premature death, mostly due to accidents and suicide. However, long-term treatment with ADHD medications significantly reduces those risks. /r/n/r/n Treating adult ADHD improves symptoms and typically leads to better outcomes and quality of life. /r/n/r/n Studies have consistently shown that treatment, both medication and therapy geared toward ADHD, decreases accidents, brain injuries, criminality, substance misuse, suicide, and self-harm, and improves work functioning and relationships. /r/n/r/n If at least one parent has ADHD, there is a significantly increased risk of ADHD in their children. Heritability is estimated at 77%, 88%. /r/n/r/n The primary types of medications used to treat ADHD include stimulants, antidepressants, and non-stimulant medications. These are designed to influence neurotransmitters, such as dopamine, that send signals between nerve cells in the brain. /r/n/r/n Two main types of therapy seem to be most effective for ADHD. /r/n/r/n Cognitive behavioral therapy, CBT, /r/n/r/n CBT is a type of psychotherapy, or talk therapy, that focuses on how thoughts, feelings, and behaviors impact each other. Thinking differently and exploring and challenging negative or maladaptive thoughts can change feelings and behavior. /r/n/r/n CBT helps to improve emotional self-regulation, impulse control, stress management, and everyday executive functions such as managing time, planning, and task completion. It also leads to more positive beliefs and thoughts about oneself. /r/n/r/n Dialectical behavior therapy, DBT, /r/n/r/n DBT is based on CBT but with several differences. DBT was specifically created to improve emotional self-regulation challenges in borderline personality disorder but has been applied to many conditions with emotional regulation challenges. /r/n/r/n There's a strong focus on self-acceptance and the ability to change through more adaptive, flexible thinking, skill building, and support and validation from the therapist. Skills training focuses on mindfulness, distress tolerance, managing actual or perceived emotional distress, emotion regulation, and interpersonal relationships. /r/n/r/n While living with ADHD can be challenging, it also comes with strengths. /r/n/r/n Though commonly viewed as a childhood disorder, ADHD can continue into adulthood. However, adult ADHD often goes untreated. Untreated ADHD can lead to impairments in functioning. Treatments for adult ADHD, including medication and psychotherapy, are effective at improving quality of life. /r/n/r/n/rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.